Howdy everybody, welcome back to MSK. My name is Jonathan, and today we will be going over the elbow anatomy. Let's hop into it. So we'll start off talking about our bones, beginning with the radius. This will be the lateral bone of the forearm, so that will be this bone out here. And remember, whenever I'm saying lateral or medial, I'm talking about the anatomical position. So with your arms dropped down, palms facing forward, that's anatomical position. So the radius will be the lateral bone, and the radius is going to be very small and thin proximally, and then is going to get bigger as we approach the wrist. We can contrast that with the ulna, which is the medial bone of the forearm, this bone here, and this bone is going to be a little thicker proximally, and then get thinner as we approach the wrist distally. And of course, no elbow would be complete without the humerus, which will be the long bone of the arm that will articulate with the ulna and the radius distally to complete the elbow. All right, let's move on and talk about the muscles. Now, there are a lot of muscles that act on and insert near the elbow. Too many, if you ask me. And so we're not going to be able to go over all of them in this video. You can check out the anatomy videos for more details about each muscle's action, insertion, and innervation. So we'll quickly touch on some of the muscles involved here. So here I've grouped them by their actions, but as you'll see, some of them have more than one role. So starting with the flexors of the elbow, you should really be thinking about the biceps brachii, brachialis, and brachioradialis being the main contributors to that motion. The flexors of the elbow will make up the anterior compartment of the arm in front, whereas the extensors of the elbow will make up our posterior part, which will be mostly the triceps brachii, but the anconeus does help out just enough, so we'll go ahead and put him down too. And if we consider the supinators of the forearm, that will mostly be our biceps brachii and supinator. So recall that our biceps tendon will come down to insert on the radial tuberosity to contribute to supination in addition to flexion. And the supinator has a very interesting shape where it will originate on the lateral humerus and on the posterior ulna and sort of wrap around and insert onto the lateral radius. Now, the brachioradialis is interesting because it actually plays on both sides of this war, as it acts as both a supinator and a pronator. So that brachioradialis will come from the distal lateral humerus and then come down to insert before the radial styloid. So in addition to flexion at the elbow, the brachioradialis will also contribute to supination of the forearm if the forearm is in pronation. If the forearm is in supination, as it is in anatomical position, the brachioradialis is actually a pronator. So the pronators of the forearm will include the pronator teres, this muscle here that will originate on the medial epicondyle of the humerus and the ulna, and then insert onto the radius, in addition to pronator quadratus, which is a small rectangular muscle more distal down the forearm. And of course, the brachioradialis is also a pronator. And so the way I like to think about this is that the brachioradialis is only happy when you're doing hammer curls, and you have that neutral between supination and pronation position with your forearm. Something to mention before we move on to ligaments is to talk about insertions here at the elbow. So on this medial side, there is going to be the pronators and the flexors of the wrist, whereas on the lateral side, we're more likely to see the supinators as well as the extensors of the wrist. So again, wrist flexors are going to be medial, wrist extensors are going to be lateral, which will be important when we talk about epicondylitis in the next video. All right, let's move on and talk about ligaments. Now, ligaments can always get a little crazy, so just stay with me and we'll go over some of the basic ones involved with the elbow. As always, let's orient ourselves first. So here we have a medial view and here's a lateral view. And at the bottom in both, we'll have our ulna and then our radius with our humerus at the very top. So beginning with our ulnar collateral ligament. So as we said earlier, the ulna is that medial bone of the forearm. So we'll be looking at our medial view. And the ulnar collateral ligament will be connecting the humerus and the ulna, giving us this ligament right here. Next, we'll have the radial collateral ligament. And again, the radius being the lateral bone of the forearm, we're going to look at our lateral view, which will connect our humerus and radius on the lateral side. And lastly, we'll talk about the annular ligament. Now, in my opinion, if there's one to know, it's this one, and that's because there's a pathology associated with it. So this annular ligament that you can see on both the medial and lateral side is a ring that is going to go around the radius, and it's going to help keep it in place to the humerus. So now let's talk about those articulations. So beginning with the humeral radial joint, that's where the head of the radius and the capitulum of the humerus will meet. So the capitulum, capit meaning head, and so that will be the round part of this humerus here, and that's where it will meet with the head of the radius. And so movement on that round capitulum of the humerus allows for supination of the forearm. But we can have a subluxation of that joint, leading to something called nursemaid's elbow, which is an injury very often seen in kids, in which sometimes a pulling motion can drag that radius outside of the humeral radial joint. That annular ligament isn't quite developed enough to hold it into place, and then you can imagine what would happen. The kid is in pain, and they will have difficulty supinating their forearm. And we have the humeral ulnar joint, where the trochlea of the humerus and the trochlear notch of the ulna will articulate, and this is your classic hinge joint. And finally, we have the radial ulnar joint, where the head of the radius and proximal ulna will meet, and there will also be movement along this joint when there is supination and pronation of the forearm. All right, let's do a recap, and then we'll do a practice question together. The three bones of our elbow will be the radius, ulna, and humerus, with the radius out here laterally and the ulna inside medially. The elbow will be the site of action for the flexors with the biceps brachialis and brachioradialis, and the extensors with the triceps brachii and anconeus. We have our biceps brachii and supinator, which will always supinate, and we have our pronator teres and pronator quadratus, which will always pronate. But the brachioradialis will swap actions depending on the position of the forearm. Our ulnar and radial collateral ligaments will help provide stability for the joint. An clinical tie-in is that the ulnar collateral ligament is often injured in baseball players. The constant valgus stretch of pitching can constantly irritate or damage the ulnar collateral ligament. And of course, that annular ligament will help keep the radius in place against the humerus at the humeral radial joint, where if there is subluxation, we have nursemaid's elbow, and we have the humeral ulnar and radial ulnar joint. A practice question might sound something like this. A 4-year-old female comes to your clinic with complaints of left-sided arm pain. The patient's father reports letting her hold the leash for the dog while they were on a walk. When the dog darted at a nearby squirrel, the leash pulled on the patient's arm. Vital signs show a heart rate of 106 beats per minute, a blood pressure of 125/95, and an internal temperature of 38 degrees Celsius. On physical examination, you notice that the patient is holding her arm in slight flexion and pronation. The patient refuses to move the arm, but there is no decrease in sensation along the arm, and the patient denies tingling. Imaging on ultrasound shows subluxation of the radial head at the humeral radial joint. What ligament of this patient is most directly involved in the injury? Well, I hope you were listening when I said that there was a ligament worth remembering, and so the annular ligament is going to be responsible for holding that radial head in place. And when there is subluxation of this joint and we have nursemaid's elbow, and we have that young patient coming in with an injured arm, then the annular ligament is most directly involved in this patient's pathology. All right, that's everything from me today. Thanks for watching. Good luck studying, and I'll see you next time.